My name is Marlene and I'm a patient of Dr. Shah. I am not the typical patient of Dr. Shah because my nerve damage was caused by a virus. In 2021, I contracted neuroinvasive West Nile virus, which attacked my brain and my spine. The infection damaged cells in my spine, which then caused upper body nerve damage, weakness, and the paralysis of my right arm and shoulder. When I left the hospital, I couldn't move anything except my fingertips occasionally, touching my fingers to my thumb. I was in chronic pain from nerve pain, joint pain. I had to wear a sling and a shoulder brace because of the weight of my arm pulling on my joints. I went to chiropractors, neurologists, infectious disease doctors. I paid for expensive trainers for aquatherapy, assisted arm exercises, but nothing was working sufficiently. I regained very little, but I wasn't still able to use my arm. So that's when we started doing a lot more research, and that's when we came across the Center for Hand and Upper Extremity. I called, and I guess the woman I spoke to was a patient, so she was lovely, she understood, she was the first person who actually listened and said, we're gonna be able to help you. And she sent me to Dr. Shah. She said he would be my best fit. He treated me for about 6 months prior to surgery. He signed me up for occupational therapy with his occupational therapists so I could build a rapport and they could see what I could actually do and not do. A few EMGs were performed to see which nerves function better than others. Surgery was long. I was under anesthesia for about 9 hours, so coming out of it the next day was not fun. But Dr. Shah was able to successfully, reroute 3 healthier nerves for 3 damaged nerves. Recovery's what Dr. Shah anticipated, what he expected. I wasn't in a lot of pain because of the nerve block that they put on and they paired me for everything. It was just more discomfort. It's uncomfortable. I had to wear a sling for 6 weeks, 24 hours a day, even in bed, to allow the nerves to set and heal. Very uncomfortable, but worth it in the end. And that was about 2 years ago that I had surgery, just over 2 years. All 3 nerves attached and healed successfully. I am able to use my arm to lift and do things. My deltoid muscle is still weak, too weak for me to raise my whole arm, but I am functional. Before my arm just hung, I wasn't able to do anything. I ended up eventually, after the surgery, I was able to go back to work. And things like that. And Dr. Shah's my hero. I highly recommend Dr. Shah. When I was unsure, he sat with me. He was not in a hurry. We postponed the surgery. He said, let's talk about it. If you're not comfortable, I don't want you doing it. He wanted to make sure that I was all on board for it. He wanted to make sure that I knew exactly what I was in for. He showed me videos. He talked about recovery. And again, from the get-go, he told me, that it was a difficult surgery for him. It was different. It wasn't the same. So his upfront and honesty with me made me feel more comfortable. And I would recommend other people to do the same.